Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Rectus abdominis, informally known as the abs muscle, is a long muscle of the anterior abdominal wall. In those with low body fat, it is clearly visible beneath the skin forming the six-pack. It extends from the rib cage all the way to the pubic bone. Origin: pubic symphysis, pubic crest. Insertion: xiphoid process, costal cartilages of the ribs 5 to 7. Innervation: intercostal nerves T7 to T11. Subcostal nerve T12. Blood supply: inferior epigastric and superior epigastric arteries. Contributions from posterior intercostal, subcostal and deep circumflex arteries. Function: trunk flexion, compresses abdominal viscera, expiration. Clinical points: myocutaneous flap. The transverse rectus abdominis muscle flap is a free flap used for breast reconstruction surgery. A segment of the muscle is incised and raised along with the perforating inferior epigastric artery and anastomosed with branches of the internal mammary or internal thoracic artery. Abdominal hernias. A hernia is an abnormal protrusion of an organ beyond its usual cavity. The anterior abdominal wall and inguinal region are common sites for hernias. Spigelian hernia. This occurs when the fascia or musculature of the linea semilunaris is weak, allowing bowel to herniate through. The linea semilunaris separates the lateral margin of the rectus abdominis from the lateral abdominal muscles. Umbilical hernia. This is when the posterior surface of the umbilicus is weak or becomes weakened and it causes an outpouching of the bowel. It occurs in children where it usually disappears itself. It also occurs in conditions where the intra-abdominal pressure is raised. Example, ascites from liver disease or pregnancy. Para-umbilical hernia. This occurs when the fascia or musculature around the umbilicus is weak, allowing bowel to herniate through. Epigastric hernia. This occurs when the fascia or musculature of the epigastric region is weak, allowing bowel to herniate through the linea alba. Omphalocele or exomphalos. This is a rare defect of the anterior abdominal wall when the muscular layer fails to close, resulting in the abdominal content being held outside the abdominal cavity in a sac. It is associated with chromosomal abnormalities such as Edwards syndrome, that is trisomy 18, and Petu syndrome, that is trisomy 13. Gastroschisis. If the anterior abdominal wall fails to close during the fetal development, the contents of the abdominal cavity may herniate out. This is similar to omphalocele, but it usually does not involve the umbilical cord and is to the right of the umbilical site. Thank you. Have a nice day.